Thank you, John. Moving to a different cartoon. This is little Lucy here, who's sitting there, psychiatric help, 5 cents. I guess that's the theme of tonight, is if only it were just available for 5 cents. What I'll be talking about more today, though, is what happens during psychotherapy. So we've heard that psychotherapy really can work and can work really well. But what are the active ingredients? What are the components? What is it that actually happens during psychotherapy that makes it effective? So one of the questions first is, why do people seek psychotherapy? Well, often it feels it's because you've got like the weight of the world on your shoulders and you need help. Or sometimes it's you have a sense that something's not going right and you really want to be able to understand things better and you want to get some help to deal with some things that you're questioning. Or it can actually just feel like my life is on fire. Help, I really need to deal with something right now. Things are really urgent in my life. The other thing that we can see here, this is a little baby who's looking in the mirror. I'm going to take this slide actually from Carrie, who's a fellow psychologist as well, is the idea of self-reflection. The process of psychotherapy is that I'll be able to look at myself and understand myself better through the process of psychotherapy. Will I be able to basically have better vision into who I am and what I need to do to feel better through engaging in psychotherapy? Is that what happens that's helpful? Well, let's look at what the research shows. So we've heard from John, psychotherapy works. But what are the components or the active ingredients? So there are many factors. The first factor that's really important that we look at are patient factors. Factors like, as John talked about, complexity or severity of symptoms. That's one factor that predicts outcome. Another factor is level of motivation, how motivated a patient is in engaging in therapy. Another key one is patients' expectations and hopefulness. So people who are more hopeful or who have the right expectation that matches what they're going to get in the psychotherapy have much better therapy outcomes. Now this is really important. One of the things that I do when I run group psychotherapies in terms of helping to enhance patient expectations is I actually do pre-group preparations. So I meet individually with everyone who's going to join the group to make sure that they're well prepared, well informed, so that they understand what to expect when they join the group, how to be most engaged in the therapy to gain the most effectiveness from the therapy, and basically dealing with some of the myths. Like they may be joining an interpersonal therapy and think it's going to be like AA, where they're going to go in and say, hi, my name is John, and it's been 5 weeks since my last drink, and that each person would go through and talk about what who they are and what their experience is in that type of way. But and then we get a buddy, for example. But that's different than our type of psychotherapy, where it's much more of an interpersonal group where people are sharing their experiences, but it's like a therapy group, not a support group, and sort of dealing with those myths. Therapist factors, John mentioned some of these, the training level, the skill level, the experience level, cultural factors. Therapist factors are very important predictors of outcome. The type of treatment, we've heard a lot about evidence-based treatments. These are very important. Cognitive behavioral therapy, interpersonal therapy, which is IPT. EFT is emotion-focused therapy. These evidence-based therapies predict good outcomes. But perhaps the most important is the therapy relationship itself. And people often don't think about that part of it. That part of the pie, if you will, of what predicts outcome is a very, very big piece of the pie, the therapy relationship. So more on that. So this is a guy who's sitting there with Dr. Fish, and he says, you don't say much, but I'm told it's the therapy relationship that counts. So yes, it is the therapy relationship. This really is important. And then thinking about the relationship, I ask you, what is it? Do treatments cure disorders, or do healthy psychotherapy relationships heal people? We're talking about relationships as healing people. This is very important. Relationships matter. And the relationship between the therapist and the patient really matters. So we know that from clinical experience and research, it consistently shows that the therapy relationship and how well the therapist responds to their patient accounts for more positive psychotherapy outcomes than the particular type of treatment method. So there's a whole task force of the American Psychological Association that got together and did a comprehensive review, and they answered these questions. What are the effective elements of the therapy relationship? How can therapists best adapt that therapy relationship to each individual client that they see? And Dr. Norcross, who I had the pleasure of attending a conference that he talked at in Toronto, talks about this and reviews all of this information in the Psychotherapy Relationship Therapy That Works book. For those of you who are therapists, I highly recommend this book. It's a great book and it focuses on the therapy relationship component. So what are the effective components of a therapy relationship? Well, research answers this question quite clearly. The first and foremost is therapy alliance. So therapy alliance is very important in individual therapy. The other is the therapist's empathy. The other is collecting client feedback. John talked about that, and I'm going to talk some more about that as well. Positive regard and support that the patient experiences from their therapist, and in group therapy, group cohesiveness. So a little bit more details about this. So alliance in individual psychotherapy as being a really important factor that predicts outcome. What is alliance? Alliance is really, it's the quality, it's the strength of the relationship that exists between a patient and their therapist. It's the bond, the fact that we're working on the same goals, that we're working on tasks together. So I'm not going to go into, the research results are there, but just as a general thing, overall saying over 14,000 patients are included in studies that have shown the importance and the robustness of this relationship between strength of alliance and therapy outcomes. Empathy. Empathy is another important. How well and how sensitively does your therapist listen and understand your feelings? And this empathy is not assessed by asking your therapist how empathic you think you are. It's by asking the patients how much empathy do you experience from your therapist. And that's a huge predictor of positive outcomes. So patients who feel empathically listened to have better outcomes. Collecting client feedback. So therapists who systematically assess through paper and pencil questionnaires, through some standardized method, how their patients are feeling and how they're doing, and then get that information, look at it, and then feed that information back to their patients in the sessions. That type of process leads to more positive therapy outcomes. Positive regard and support. So what do we mean by that? We mean by that the patient who feels prized, who feels that their therapist really is caring for them. That feeling that you are unique and that you are important, and that you get that feeling from your therapist. Study after study and meta-analysis shows that that's a very powerful predictor of positive therapeutic outcome. And in group psychotherapy, and I love running groups, the parallel of therapy alliance is the cohesiveness of the group. How well the group hangs together, how well the group is bonding together, that the powerful sense of togetherness and not feeling alone. That's the power of group. And when there's a group that's highly cohesive in an interpersonal therapy, that leads to positive therapy outcomes. So what are some basic tips that we can take away from some of this? This is just a little snapshot of what the research shows in the literature. Well, one, if you're a therapist out there, that one of the things the walk-away messages is really make the creation and cultivation of your therapy relationship with your patient be really a primary focus. It's really a really important first fact. We take it for granted, but the importance for clients to feel safe, to feel listened to and valued. Also, we need to constantly be adapting the relationship to our specific client needs. And be ready to shift, because a client might not be ready for a change. They may be sort of pre-contemplating or contemplating making a change. And we may be very keen therapists and be ready for action, but if that's not where the person's at, we're not going to be able to help them. We have to be ready to be where they're at in their change process. And again, like we said, routinely monitoring your client's progress and response to both your therapy relationship and to how they're doing in the therapy is really important, and then reviewing that with your client. And again, learn how to continue your growth in terms of evidence-based practices is really important. And evidence-based relationship factors like empathy and alliance are really important in terms of treatment outcomes. If you're a client, what are some key recommendations? Well, one is choose the right therapist that can meet your needs. That's really important. The other is engage in the therapy process when you feel ready and motivated to make use of the therapy relationship. That's when you're most likely to benefit from it. The other is expectations. If you're expecting that things will go well, things are more likely to go well. The other is, of course, important is to choose a therapist with whom you feel comfortable. We could talk more about how do you go about doing that afterwards in the discussion. 6 behaviors a therapist should avoid doing in therapy. I'm not sure why this is not, usually this guy dances around, so he's not dancing, I'm not sure. But these are the types of things that usually don't work in psychotherapy. So if your therapist has a very confrontational style, it's not effective. Therapist is too rigid and structured. In fact, studies have shown that therapists who are very experienced and actually do a good job of building relationship with clients, when they're forced to do manualized treatments and follow a rigid structure, they're less effective because they're being too rigid. So actually, flexibility and responding flexibly to our patients is critical. Again, being negative and rejecting, counter-therapeutic, making assumptions rather than asking and understanding, and ignoring the client's experience. Bad therapist things to do. Relationships matter. Relationships are really important. One of the things I wanted to share with you, I talked before about Dr. Norcross and the Relationship That Works book. The other book that he shared, and he had just a quick slide on it, and it comes back to what you were talking about before, kitchen table wisdom. You mentioned, Christine, that the group that formed Hopewell was actually formed over a kitchen table. And what this book is about by Dr. Rachel Naomi Raymond is really about the wisdom that comes in the stories that we tell and how there's real healing in listening to each other's stories. And she comes from the perspective of being a physician, of a woman who's lived with Crohn's disease, a chronic illness, for over 45 years, and that of being a counselor. And she talks, there's so much wisdom in the stories that she shares. So he just showed this book, and I went out and then I purchased the book that weekend. And then George said, "Where were you all weekend?" And then basically I was reading the book. George is also my husband, by the way. Should have mentioned that earlier. So, Dr. Tasca. So I read the book in one weekend, and it really touched me. There's a lot of pearls and gems of wisdom in this book. So I thought I'd pass that forward to you as well. Slide. And thank you. And spring is here, which is wonderful. Thank you